What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, January 31st, 2024. This is actually the second video we are doing today. If you did not see, I did an extra video today. We haven't done a 2-video day on this channel in quite some time, but today I thought required it. Let's face it, the world is sick right now. There's a lot of people continuously getting sick again and again, or something I just saw after posting that video where public figures are posting that they tested positive for COVID. Then you go to the comments mixed in with all the, oh, get well soon, blah, blah, blah. Well, I just had COVID, or I've been sick for many months, or since I've had COVID, this has happened, or that has happened. I mean, on or on it goes. It's totally ridiculous. If you want to see what I said earlier today, just see the video that's right below this one. Hopefully that gets through to maybe some of our leaders, or someone of high power, or some media person, and they say, whoa, look what this person is saying. I would gladly do an interview with them. I gladly would. Okay, let's get into today's pandemic update. We have a ton of things to share with you today, and if this is the first time you've seen my pandemic update, it's where I share the news of the day with the virus and other viruses. You know, the big one, COVID, but we're going to talk about several different viruses today. If at the end of this you learn something, give it a thumbs up and subscribe down below. All right, our first stories is, we're just going to read a headline on some of them because there's just so many of them today. Report, at least 8,500 schools in the United States at risk of measles outbreaks. The CDC says most of the new cases were seen among children and teenagers who had not been vaccinated against measles. 8,500 schools. That is a heck of a lot of schools, and that is highly concerning. All right, moving on to our next story. If you want to see any of these stories, I try my best to tweet all of them out on my Twitter so you can read the full story, because we don't obviously have time to read through every story. It would end up being an hour-long pandemic update. We don't want an hour long. Cambodia reports 2 more human H5N1 avian flu infections. This is something that has been ongoing. The cases are the first of 2024 and raised the country's number of cases since early 2023 to 8 cases. All right, next story. This one is concerning. This is in Australia, Victoria. Mpox alert records first locally acquired case in months. Mpox is still out there. We sometimes find it in the wastewater here in the United States, and it still pops up here and there around the world, despite no longer being an emergency. So yes, it's something you still have to look out for. All right, Dennis the COVID guy. We've shared his tweets before. We're going to share another one today. Dennis the COVID guy. Taiwan, COVID-19 deaths hit 5-month high. There were 64 COVID-19 related deaths reported last week, the highest weekly number in 5 months. The JN.1 subvariant accounted for 52% of sequence cases, and EG.5 strain at 35%, and XBB 1.5 strain at 7%. Trust me, this is not the only time today during this update that you are going to see places with highest deaths in quite some time. Let's continue on. We have something else from Dennis today. India, this is really concerning. India has a lot of people living in their country, so this is bad. India, nearly 1,600 doctors died of COVID-19 in India, 757 during the first wave, and 839 in the second wave. They are COVID warriors who were exposed to the infection while treating patients. I mean, India has over 1 billion people. They cannot afford to lose any doctors. They need as many doctors as they can get, and well, look at this. India lost 1,600 of them in just the first 2 waves alone. Mind you, there have been more than 2 waves of COVID in India. Now we move over to Corona. Heads up on Twitter. Russia. COVID still increasing in Moscow. 6,505 people caught COVID-19 in Moscow last week. 585 people were hospitalized. 5,134 people recovered. And 18 patients died. A week earlier, 5,066 cases were reported. So yes, cases are still rising there. Then we come to this story, and we want to spend a little bit more time on this story because there's some very concerning stuff in this story. Wastewater tests show COVID infections surging, but pandemic fatigue limits precautions. Now you're thinking, wait a second, that says COVID test infections are surging? Well, yes, we've talked about this several times now, since about last week and a half. Not all areas are following the national trend, which is lower infections. In fact, one region as a whole, which that is the West Coast, is now starting to see a slight rise again. There are wastewater sites randomly scattered throughout the country that are seeing rises again. And this is really concerning, and this does kind of highlight that, but it also talks about a couple other things in here that are relatively concerning. And I do want to point out something down here. It says alarm bells are going off in other states as well. Indiana's most populous county asked residents with mild symptoms to avoid crowded emergency rooms to prioritize care for patients seriously ill with COVID-19 and other respiratory illnesses. Then we come to this, and this really was an alarm bell for me. Never mind with 2023, Michigan reported its highest COVID-19 death toll since late 2022. That's right, they just had a death report of around 156 in mid-January. That was higher than any other report they had for a week in all of 2023. I ask with that, just what the heck are we doing? A death toll that just came in that's higher than any point in 2023. So we've actually gone back in a time machine. Remember the movie Back to the Future? We actually went back in a time machine and did a number from 2022 here in 2024. That, my friends, is a very concerning trend. And right now, the trolls are probably watching this video saying, oh, this crazy man is going on and on saying deaths are going out of control. Hello, these are legitimate numbers. Numbers that don't lie. Numbers that are likely actually an undercount. And here we are, we just did a number that we have not done in the state of Michigan since 2022. Let me continue on. In mid-January, Illinois saw a 17% jump in COVID-19 hospitalizations in 1 week earlier this month. Remember, the country was supposed to have already peaked, but here we are. We have places that are starting to rise again. And let's just reverse up here a little bit. Deaths have declined more slowly in states with older populations such as Vermont, Hawaii, and Maine, according to Straight Line analysis of preliminary data of federal Centers for Disease Control Prevention. Vermont hospital employees started masking again earlier this month amid the new surge. So, I mean, some states are still rising. When we take a look at Walgreens in just a little bit, you'll see Vermont is actually one of the states rising for the positivity rate right now. So this is not good. All right, moving on to this now. BFHD calls for public to report positive at-home test results. BFHD, you're probably wondering what is that? Well, Benton Franklin Health District code number. This is out in the West Coast. This health department is asking that people start reporting their at-home tests. Quite frankly, why should it just be one health department? CDC, hello. If anyone who works for the CDC is watching this video, please pass on the word to Mandy that, hey, we need the entire country as a whole to make it mandatory that you report your at-home test. Come on, we need to see the real numbers of this virus. All right, wasn't certain I was going to show this. I think I need to show this. It may be hard for you to hear. I'm going to turn up the volume here so you can hear this. We're going to max out the volume because I want you to hear this. This was during a media briefing today at the White House. Let's go full screen. Why not? I want you to hear this. Now, she was speaking. Watch what happened in the background. I have it set up right for the spot. Listen, because this has been happening often, not just at media briefings. It happened on News Nation the other day as well. Listen, have a listen.
Has met with Americans with varying opinions about the conflict that we're seeing, sadly, in Israel and Hamas. officials at the White House have had numerous conversations and in regular contact with Muslim and Arab Americans, leaders in Michigan and across the country. Hopefully Sam is okay. Get some water. Concerned for him. Um,
You heard that. Hope this man is okay. Can you get some water? Yes, yet again, another coughing fit. It's just ridiculous. These keep happening again and again and again, whether it be at press conferences, on the news. Like, you'll hear these press conferences and you'll hear numerous people coughing in the background. If you ever watch C-SPAN, the House of Representatives or Senate, listen to the background. It's an endless sea of coughing at some times. It's just totally ridiculous. Alrighty, moving on. Let's now take a look at today's air qualities around the U.S. I have to refresh this because it will gray out on me every so many minutes. And you'll see it's kind of a mixed bag thing going on. We have a big storm system in the west coast. Things are not too active up in the northeast, but with that being said, there's a lot of cloud cover, and for whatever reason, it's just poor, moderate air quality. So you do see a couple oranges mixed in up in Canada. And take a look at the west coast. There are a few bad air quality sites here and there. If you want to learn more about weather and the climate, I do have another channel, which we did do a video there today talking about the storms in the West Coast and everything else that's going to be happening in the United States. Speaking of climate, some well above average temperatures are coming, and for many people, it's not going to feel like winter whatsoever. So, yeah, that's not a good thing whatsoever. Subscribe to that channel down below. There'll be a little card for you to check that out. Alright, as I was talking about earlier, not all regions of the United States are dropping. See this green line here on BioBot? That means wastewater has trended up slightly again in the West Coast. Will that continue on the next update? I'm not certain. Maybe it'll start going back down, but hey, we take note of it. We see it. All right, taking a look at Walgreens now. Here's the national positivity for Walgreens, 27.2%. While that did go down, you do see some red here and there. Remember I mentioned Vermont? Yeah, Vermont's positivity this week, it actually did go up to 20% versus 13.3%, 6.7% increase, and that's with total testing being up as well, 20 versus 15. And you see there are multiple other states that have had rises as well. Tennessee is one of them, and hey, Tennessee's testing, it's up 522 versus 435. On and on it goes. Here's another one. Georgia, it went up as well, and testing did go up. So you get the idea here. There's some states rising. We'll have to see next week if this trend continues, and we'll have to see if it spills over to wastewater update that will come in on Friday. All right, let's take a look at some CDC data here, and you can see here last week there were 26,607 hospital admissions. That's down by 14%. There's not enough states at this point in time to push that back up. And will there become enough states? I'm not going out and saying no. I don't think it's going to happen, and if it does happen, that's a huge surprise, and that would be very, very concerning considering we just had such a large wave. In fact, the second biggest wave of the pandemic back in early January and late December. All right, moving on now. Let's take a look at what is going on in Philadelphia today, and I do have good news for my city today. Just 688 EMS incidents yesterday. Now, I'm saying the word just. Some people are probably saying that are new to the channel, wow, well, that's a lot of calls. It is, but it's at the lowest it's been in quite some time. We haven't had a day below 700 EMS calls in quite some time. It's good news. It's good news. I hope they stay low, and they've been in the low 700s for multiple days now, so I am encouraged about that. Let's do a live look in at what's going on in Montgomery County. Let me refresh this, and yikes, I'm seeing a lot of respiratory emergency calls here. 1, 2, 3 respiratory emergency calls, multiple cardiac emergencies, including cardiac arrest, so that is not good. And let's hope for some better news in Chester County, and yeah, Chester County have 3 respiratory calls as well. Multiple falls, we're seeing heart problems, we're also seeing maternity, labor, childbirth. Congratulations to the person that just had a baby, and we're also seeing choking. Yikes, yeah, that's not a good thing. All right, 989 hospitalizations in New Jersey today, with 69 out of 70 hospitals reporting. You will take note here, this is something actually concerning. While overall New Jersey is still dropping, that dropping is not happening as fast. In fact, back on the 28th, they actually had an uptick. See, if you've been watching my videos, you know New Jersey does tend to correct themselves when they get more hospitals reporting. And in this case, they did. On the 27th, they were 994. Then they had jumped up to 1,067 on the 28th. That's not a good thing. And right now, 989 for 2 days. Yeah, I mean, they're down from 1,067, but it's not a rapid drop right now. The dropping has slowed. I'm concerned about that. On a ventilator, 32. In the ICU, 117. And discharges, 149. So there were 149 discharges in the state of New Jersey. Let's take a look now at what is going on in New York State. 1,803 people tested positive for COVID in the last 24 hours, and we do want to take a look at New York State hospitals, admissions, and hospitalizations. And you can see the admissions in New York State, they continue to drop. We're not seeing any signs of a rise in New York State just yet. Someone the other day left a comment, I think it was earlier today, asking, well, how come in some states it's rising and other it's not? You know what? It's really hard to pin down why that is. It really comes down to your local climate. And I'm not talking about weather. When I talk about local climate, what's going on? Do you have events going on? Do you have things such as major sporting events? Is there a large convention going on in your town? You know, it really goes down to your city, state, local municipality. If something just happened in your area, which could lead to spread, you know, it could be the cause of a new wave in your area. Like, for example, Vermont. Vermont's starting to go up again. Well, we have to think about what's going on right now in Vermont. It's wintertime in Vermont. Vermont's a colder state. So in this case, yes, I'm talking about weather now. Vermont is a colder state. There's a lot of skiing that goes on in Vermont. It was just Dr. King weekend recently. So Vermont could be seeing an increase because of the influx of people that came up to go skiing. You know, it really varies state to state. In my area, we have a lot of people that went back to work, back to the office for the first time since the start of the pandemic. Work means that results in cases. There's many different things that could result in a rise. And one big one that I do not want to miss out is, you know, there could be local new lineages that form in your own area. A new lineage of COVID. It can pop up anywhere, anytime. Remember the BA.2, .12, .1, or was it .2? I don't even remember. In New York State. But hey, that started in New York State, and it eventually spread across the United States. It could be happening in local areas, and people travel from one place to another. They bring their case of COVID, and suddenly COVID is spreading in their community from that new lineage. Yes, every day there are lineages that get picked up, whether it or that get generated, whether it be a small one or a big one that becomes the next JN.1. Who knows? I'm not saying it has happened, but it can happen. All right, one last thing we want to take a look at here, and that is Colorado. Let's see, the Colorado update for today. Sometimes they do update on Wednesdays, and look at that. They did update today. Currently hospitalized is 163 people in the hospital. Can we take a look at cases? And cases actually, look at this. Cases went up. 2,160 cases reported this week. That's an increase of 129. So we now add another state that's rising, and I do believe this falls into the West Coast. Let's take a look at BioBot. Yes, Colorado would be in the West Coast, so another state that is the potential cause of why the West Coast wastewater is starting to rise again. Nothing out of Texas today. I still can't find Texas. Hopefully in the near future, we will get back to reporting on Texas again. Alrighty, folks, that does it for today's pandemic update. If you learned anything in this update, give it a thumbs up. If you liked what you saw here and you want to watch more of my videos in the past or in the future, by all means, please subscribe to my channel. I do have a channel goal this year. We're challenging ourselves. Can we get the channel up to 10,000 subscribers this year? I hope to. Not for personal benefit, but I want more people to be informed. I want to keep more people safe. And I really want to grow this channel and get the message out there loud and clear that there are far too many people sick, and it is ridiculous that people continuously get sick again and again, and that there is no attention on this. I want to become a credible news source. So help me by doing that, by sharing these videos, and subscribe to the channel down below. I'll see you all again tomorrow, because for as much news as I just shared with you today, I'm sure there'll be just as much tomorrow, if not maybe more. Alright, see you all again next time. Stay safe, and have a fantastic Wednesday evening. Thanks for watching.